Hey everybody, it's Felicia today at Arizona Facial Plastics, and it's Friday. Woohoo! Hopefully it's a payday for you. Yes, I stole that from somebody I listened to on the radio. They say it every Friday. It is a payday here, so my employees are happy. I am with Judy Sawyer, one of our patients here at Arizona Facial Plastics, and she has very graciously offered to sit and talk with me a little bit about her experience here as a patient. And so Judy, we were just talking dates, and you said that this December will be a year since you made a really big decision.
Exactly.
What did you decide to do?
I decided to have a facelift, and what led me to that decision was I was seeing someone who was a photographer, and he took some pictures of me. And I looked at the pictures and I thought, this does not look like me. This is not me. He's just a terrible photographer. But no, it was me.
Wait, so did you drop him because he was a bad photographer?
Yeah,
then?
I did. I left him. I was out of there.
So, note, people, don't take bad photos of someone because they might not date you anymore afterwards.
That happened.
That's awesome. So you saw the pictures and
I saw the pictures, yeah.
It didn't feel like you.
It didn't feel like me. I kept looking at this picture going, oh my God, I can't look like this. And so that's what kind of led me here.
Okay, awesome. And so when you looked at the pictures of yourself, because I know that sometimes we look in the mirror, well, can you just tell us more about like what you were feeling? Like, why didn't it look like you? What was it?
Really, the bottom of my face had kind of dropped down, and I was getting the chicken neck. And it was very obvious in the photographs. Why I didn't see it in the mirror, I don't know. it didn't show up as much in the mirror.
Thank goodness.
But let me say it was there.
Yeah.
There was no doubt it was there. And so
yeah,
I came in here and talked to Shay.
Okay, cool. How old are you? Do you mind? You gave us a range. Just give us a range. Above 60?
66.
Okay, awesome. Which, you know, is actually a genius time to do a facelift in your late 50s, early mid-60s. And so, so you made the decision to come in and talk to Shay. And how did you find us? Like, what research process did you go through? I mean, like when you looked at your neck, were you like facelift, or did you not even know what the solution was?
I had a feeling that that's where it would lead eventually.
Okay.
Now, I had come in here earlier and had a CO2 laser.
Cool.
And the way I found you was on the internet, but I did a lot of research and I found out about Dr. T. He's an MD. He's an ENT guy, which is pretty impressive. Means he's a real doctor.
Right, yeah. So he is, Dr. T is double board certified, facial plastic surgery and ear, nose, and throat surgery.
Right.
And one of the reasons I think that's cool is because when he did his ENT residency first, he spent 5 years just reconstructing people's faces, doing, you know, in-depth nose surgeries, you know, parotid. So he really understands all the musculature of the face, not just the artistry.
Which was exactly what I was looking for. I wanted somebody who knew the face inside and out. And he's done how many surgeries?
Yeah, more than 4,000 facelifts at this point.
It's up to over 4,000 now.
Yeah.
So I was really comfortable with him.
That's awesome. So you had done a CO2 laser with us. You came back, you talked to Shay. Was there anything surprising during the consultation process or things that you would want other people to know about?
Just that Shay was very careful to let me know what expectations were and give me a really good feel for what I was going to come out looking like. Good. Because I didn't want one of the faces that was not natural looking.
Right. Yeah, I think that is one of the big things that holds people back from this decision. They don't want to look fake or plastic or... Like, to me, like when I do something, I don't want anybody to know that I've had something done. I want them to just think I look beautiful and like I got a really good night's sleep.
Right.
Which does not always happen.
Which does not always happen. And that's what I wanted. And I kept going around kind of pulling my face back and saying, okay, this is what I'll look like. It doesn't look unnatural. He's not going to completely do my whole face. It was more, a facelift is more the bottom, this part of your face.
Right.
So I had a pretty good feeling I wasn't going to come out looking unnatural, and I had complete confidence in Dr. T.
Awesome.
I knew he knew what he was doing.
Did you, was it like before and after, or was it the conversation with Dr. T? What was it that kind of gave you that certainty to move forward?
That I had the CO2 laser with Dr. T, so I knew him.
Okay. Okay, cool.
You guys are like a family here.
Aw, thank you.
As a matter of fact, after I had the facelift done, my sister had to leave to go back to work the second day, and Shay came and picked me up at my house and brought me in here. And then he said, you know, if you want, since you don't have anybody at home, come in every day. Mm-hmm. So I was able to come in every day and have him check and see everything was going okay. That meant the world to me. It really did. It gave me complete confidence that there was nothing bad happening. I wasn't getting an infection.
Yeah. Yeah, we'll talk about the healing process and what the surgery was actually like. And I think that that's super important for people to know is that, I'm going to adjust this so we can see you a little better. There we go. So it's that, you know, we're not going to come in and meet with you the first time and be like, hey, yeah, let's get your face open, you know, and that there are ways to ease into this decision so that as you're moving forward, you're seeing incrementally that things can look better. Mm-hmm. You know, and then the facelift feels at some point like the natural step to take because it's just the most effective way, cost, time, energy wise, to get you looking where you want to look. And it sounds like that's how it happened.
That's how it happened, and it kind of progressed to where that was going to be the biggest bang for my buck, so to speak. Mm-hmm. To not keep doing the skin, that wasn't going to pull all this up. There was nothing except a facelift that was going to pull my face kind of back into place. Mm-hmm. But it looked totally natural after. The healing process, I was really surprised at how easy that was.
Yeah, tell us about that. So let's, if I'll share with people that, so we did the facelift for you and we did it at a surgery center.
Yes.
And so you were under kind of a local anesthesia that put you to sleep during the surgery, but it wasn't general. So you didn't have to recover from somebody having a tube down your throat and all of that. You probably don't remember.
I don't remember.
Yes. That's good.
I'm looking at you going, I don't know.
We don't want you to remember that part. Yeah. So I'll tell the people what we did is we actually we did an IV max sedation, it's called, which is, you know, an anesthesia mix of cocktails that just puts you to sleep. But one of the benefits of doing the surgery that way is that you don't have to do the general anesthesia. And general anesthesia is where they put the pipe down your throat and a machine breathes for you during the surgery. And that can actually delay recovery times. And so part of the reason that you healed so quickly was because you don't have to recover from the general anesthesia part of it. The IV sedation wears off really quick and you can get back to feeling normal.
Yeah, I mean, the worst part, I think, was waking up from the anesthesia because I didn't want to get up. I wanted to lay there, and they weren't going to let me lay there all day, and it was very annoying.
Yes, I've been there. I had a surgery under max sedation, and when they woke me up, I was like, oh, already?
Yeah.
Like, such a good nap.
No, just leave me here for a while.
That's cool. Okay, so you woke up, and were you already wrapped at that point, or do you remember looking in the mirror at all?
I was wrapped at that point. I avoided mirrors. There was nothing interesting about a mirror to me. So my sister was there and drove me home that day, and she took care of me. There wasn't anything to take care of, though. All I wanted to do was sleep.
Okay.
The second day, I was up and doing a few things around the house. The fourth day, I went to the grocery store.
Wow. With the wraps on and everything still?
I had the wraps on, but I had a hat on and I wore a scarf and I just felt like getting out.
That's awesome. Yeah, and I think that that is also another misconception that people have about facelifts is that they have to be holed up at home for like 2 weeks or something.
No.
And that's really not the case. There's a couple things that we do and that Dr. T has innovated on to help you recover really quickly from these facelift surgeries. And one of them is the platelet-rich plasma.
I was just going to ask you about that because I did get that.
Yep, you did the platelet-rich plasma. And that does a couple things. It increases blood flow so that you heal quickly. And then it also really minimizes the scarring and the bruising. So you probably looked in the mirror and felt like you didn't look too scary, and that's why you could go to the grocery store.
Yeah, I didn't look scary at all. And I was able to kind of mask the wrapping, so that wasn't a big deal. A week after I had the surgery, I took selfies.
Oh, cool.
I sent one to the guy who had taken the photographs of me.
Like, check out what you're missing,
And
buddy.
he was astounded.
Wow.
He was absolutely astounded. He goes, you look like you looked 20 years ago.
Oh my God.
Yeah.
Oh my God, that's awesome.
That was pretty funny.
That is cool. So pain is another thing that people are really concerned about. Tell us what that was like for you.
I never took a pain pill.
Wow.
Except for a Tylenol a couple of times.
Yeah.
But none of the heavy duty ones.
Right.
I never took one.
So you just like on a scale of 1 being no pain, 10 being like excruciating, sounds like you were never above like
a 4 or a 5 maybe.
Okay, cool.
Yeah,
That's
it
huge.
was not a big deal. I ripped my meniscus on my knee recently.
Yeah.
That was 1,000 times worse than anything I went through with the facelift. The surgery was really not a big deal.
That's cool. And like, to me, that's huge because I think that's another thing people are afraid of. It's like looking fake and then it's going to hurt. And we really do a lot to try to minimize that. And, you know, you mentioned that Shay picked you up. Like, we really pride ourselves on taking care of you through the healing process.
Oh, you did.
Because we want to stay on top of that, right? Like, we want to be able to make sure everything's healing well and that you know that we're taking care of you and that we've seen it before.
And that I had a complete feeling of confidence. And what really helped too was coming into the office and having you guys just check and look and go, hey, this looks wonderful.
Yeah. And that's something that, you know, for people who live nearby, for about 7 days after your facelift, you are welcome to come in every day and we will take care of you. We will do the cleaning. We'll rewrap your face for you. We will take care of everything. And that's not something you're going to get everywhere. A lot of places will send you home and tell you to come back, you know, in 7 days for the first checkup. But here we want to walk with you on that journey because, you know, part of it is selfish. Like, we've invested a lot of time and energy in getting you to that point, and we want to make sure you don't mess it up at home by putting olive oil on your face or something weird, you know? So if you're coming in every day, then we can be guiding you through and really holding your hand through that process.
Which is invaluable because in the back of your head, you're thinking, oh, what if I get an infection? What if something happens? What if I start bleeding? What if it's not quite right?
Yeah, yeah. And there are a couple circumstances, right? Like, we've had some facelifts this past year where, you know, if you're a smoker, you're at higher risk. If you have diabetes, there's just different things. But even with those, with the patients coming in every day, every other day, we're able to stay on top of it. And luckily for you, you didn't have any of those issues. Like, you just healed beautifully.
Yeah, I was really lucky. It was really a piece of cake for me. The other thing I want to mention that I think people worry about is scarring.
Yes.
Dr. T cut your hair just a little bit right here, and the scars are back here. You never see them. They're gone. I mean, I can't.
Can I take a look?
Sure.
Yeah, you really can't. So if you want to like bring your ear up, do you mind? People, if you want to see, okay, so the cut would have been right around here, and you really, I'm going to grab this phone for a sec. We really can't tell that there was anything there. And part of that is, you know, thank you, Dr. T's level of skill with the suturing. Give you guys just a second. We'll try to get this phone back in. Hold on. All right, let's see. I'll just hold it for now. It's the type of suturing. Barbara says you look beautiful. She does, doesn't she? Okay, technical difficulties. 1 sec. Oh, there we go. Okay. So part of it is the suturing that Dr. T uses. He uses a really high quality suture. The PRP is huge, and we add something else too called amnion to it, which we did for years, which just again speeds up the healing process and minimizes the scarring. And then again, by having us take care of it on a daily basis, we're really making sure that it's healing correctly.
Yeah, I would really suggest anybody who's going to do a facelift to make sure they came in every day and had professionals wrap you and do the medication and just take a look at everything.
Yeah. And so if you're coming from out of town, we'll generally say, you know, get a hotel nearby, stay for a week if you can, because that allows us to take the best care of you. Let me think. Other things that people should know. There was another thing you said, which was where we really try to set the right expectation from the beginning. You know, if anything, when we're talking to people about facelifts, like, I almost like to make it more serious than it actually is, because then if you feel like it's an easy experience compared to what we've told you, that's a good thing, right? Like, we don't want anyone to be surprised. And so you felt, it sounds like, what we explained matched up with your experience.
Right. In fact, I think it was a little easier for me, but I luckily healed right away and didn't have to go through anything that was too tough.
Yeah. And so you are almost a year out from the surgery. Has there been other things that you've done in that year to just, I think we've done maybe a hydrofacial or two.
We've done a couple of those, and I'm going to come back for a CO2 laser pretty soon.
Yeah, and so I think that's another important component, is that, you know, as part of our facelift, we'll usually include a CO2 laser, because, you know, Judy kept saying she kept doing this with her face, and that, when people do that, that's addressing the wrinkles and the laxity, right? There's also the skin tone and texture, which, you know, no matter what age you are, if you have sun damage, if you have hormones, there's just little things on your face that don't look as clear as they could. And so by doing the CO2 laser, you did it before, and then you're going to do another one.
Right.
It just smooths out that tone and texture. And then it also helps with a lot of the little fine lines and wrinkles that maybe aren't addressed by the facelift. So it's just kind of like a nice finishing touch. So.
Yeah, I actually think I have 2 more CO2s, because I got one with the surgery, and then one after, and then I have one that I had purchased a package.
Oh, that's cool. Those I think are almost a little bit more difficult than a facelift, because you're not asleep. But we have the laughing gas now, so you can do the laughing gas when we do the,
good. I've never tried that. I'll try that.
Awesome. So let's see, is there any other stuff?
The only other thing I'll mention that was, I don't want to say a side effect, and it doesn't even bother me, but there is a little bit of numbness that stays for a while.
Yeah.
But I never noticed it. Unless I was feeling, oh yeah, this is a little numb right here. That was it.
That's a good point. And I, you know, it's totally normal with most surgeries, because with any type of surgery, you're going in and you're doing some damage to the nerves that are there, right? Like cutting through them. And it just takes nerves a little bit of time to regrow and make those connections again. You know, I had that surgery in March, and my tummy is still numb in certain areas. But, you know, it's like I just pay a little bit of extra attention not to like bump it or do anything, because you don't know if it hurts or not, because you can't really feel it, you know. But that's a good point, is that numbness is totally normal, and it seems like the feeling has been coming back.
It comes back gradually. At this point, it started out where this much of my face felt pretty numb, but within like 3 or 4 months, it was down to just this little area right here being numb, and now it's just slightly numb.
Yeah.
I do have I can go like this and feel it. Yeah. But be prepared for some numbness.
Totally normal, because again, and you know, when she looked at that whole area, that's about how far down Dr. T's going under the skin to actually like pull up the muscle and move everything. So.
And I think the numbness might be a big help too with the pain.
That's true.
So,
can feel it.
Yeah.
So, there you go. Bonus numbness.
Yeah.
So I have your before and after pictures up on the other computer there. So are you able to take a quick look at them?
Sure.
Okay. Let me grab this phone, and I'm going to take you guys over here. The lights on in this room. So I've got her pictures. I'm going to try to turn the camera. So this was Judy's before on the left-hand side here, and this is her afterwards. And, you know, I think clearly this one just looks younger, right? Like if you look through the whole mid-face. We didn't do any fillers, did we? Or did we do some?
We did it with the CO2 laser, but by then it had been about 5 or 6 months.
And what I love about your face afterwards, like number one, the tone and texture is so pretty. Like if you compare this to how much redness you had going on here, even under the eyes is just tighter. Your forehead is a lot smoother. And then all of this is just lifted, right? Like from where it was before. But I also love here, like everything was just kind of flat and falling. Like see how that's just down, and here you've got these super pretty apple cheeks that just look youthful, you know.
Yeah. Oh yeah. So, the and especially on my neck was a massive change.
Yes. I think I was gonna try to get the pictures up but we had them on different computers. So I don't know if let's see if I can get the other one. So there it is from the side view, which you can see a little bit just how the jowls got lifted, and there's just a lot more of that fullness in the cheek area there. And then I'm going to see if I can pull up the other ones really quick.
Also,
yeah,
you should look, see a lot of that went away.
Oh yeah, those brown spots. Yeah, and then that is something, again, you know, looking at sort of the comprehensive approach, the texture, the volume, and the wrinkles. And so, you know, we can do a facelift and leave your skin looking the same, but you just get a much better result if you're able to take care of a lot of those, what would you call them? Blemishes, right? And so it's just kind of cool to be able to offer a comprehensive solution for patients where, you know, you're not just fixing one aspect, you're really rejuvenating it from like a 360-degree perspective. And I think, like, look under the eyes too at how much tighter it is under the eyes there. So that's kind of cool. All right, I think I almost have your previous picture up. Let's see. 118 sound right? That would have been January of last year. Yeah. All right. So this is her 3D photo of the after. And then this one up here is the before picture. So kind of put them a little bit side by side. And you can just see, like, what's cool is that on this up one here, you know, there's really not much jawline to speak of, right? Like, it's just
right.
See how it curves out so much here, and then here you've got that completely opposite shape. What is it? Concave and convex. There you go. Yay, we remembered our geometry. You should never try to do fancy words on live things because you don't know.
But that was what really drove me nuts the most, was the neck. But the jowls also. The jowls.
Yeah, they were super low, right? Like,
yeah.
And heavy, which people don't really think about it, but that can actually be uncomfortable. Like, it's a lot of weight to carry there. And so it can just feel more comfortable when you are able to lift that, remove some of that fat, take off some of that excess skin, and just give you back that, like, you know, more youthful look. So yeah, definitely like softer,
but completely natural. There was nothing at all that made me feel like I looked like I'd have plastic surgery.
Yeah, and I think most people would look at you now and just think you look, you know, beautiful. Not like fake or plastic or pulled or anything, you know? So that's the goal, and that's we could go back in here. That's really what we're trying to accomplish for patients here, is not to make you look we'll switch spots because we're there. Not to make you look fake or, you know, done or anything like that. Just pretty and young. So who are you dating these days? TMI. She doesn't have to share that information.
TMI.
But at least you can send those pictures to that photographer.
He tried to get back with me.
I'm sure he did. Judy's awesome. One of our other pastimes is Pokemon hunting. So if you're ever looking for a partner for Pokemon hunting, go with her. She knows what to do. I don't know what to do, but I should learn someday. And then what else do you like? You have some cool birds too.
I have parrots, yeah.
And then you're super into Japanese cooking.
Yeah. And the house in Preston.
Yes, I know.
So I'm busy.
Nice. She's back in town for a while. But anyways, I really want to thank you because I think this information is super helpful and important for people to hear firsthand what the experience was like. And that, you know, it's totally normal to be afraid about those things, like looking fake or having it hurt, and that we work with you to make sure.
And it turned out to be really pretty easy for me, and the results are incredible. So I am 100% happy that I did this. But the steps to take are to find the right doctor. Okay. Double board certified. An ENT was like, that was fabulous. Yeah. To find Dr. T, and he is so caring and gentle, and that mattered the world to me too.
Yeah. Yeah. And that's key, right? Like there's someone for everyone. So do your homework, read the reviews, understand what's important to the physician and how they're going to help you. And then the first step to take, if you've been thinking about this, is to just call and book a consultation. It's no commitment, it's just information, right? But you've got to take a step forward to get to that place that you want to be.
And I would suggest that you also get the CO2 laser with the facelift.
Yeah, and we'll usually do it while you're sleeping, so you won't know
So you
any
don't even
different.
know.
You just wake up, heal all together, and have the beautiful skin on top of everything else.
True.
So cool. Thank you so much, Judy. And if you guys have any questions, let me know. And again, first step is to just book a consult. You can do that by calling us here, 480-447-9860. We'll be happy to do your consultation, do your pictures, and wouldn't it be fun to start 2020 looking beautiful and as youthful on the outside as you feel on the inside? Call us. Bye.